If you need physiotherapy in Malaysia, you have a choice between two systems with substantially different characteristics: public hospital physiotherapy and private clinic physiotherapy. Understanding the real differences, and not the oversimplified version of this comparison, helps you make the right decision for your specific situation and clinical urgency. The most practically significant difference is waiting time. Public hospital physiotherapy in Malaysia operates under high patient demand with limited physiotherapist staffing ratios. Waiting times from referral to first appointment range from 2 weeks in better resourced urban hospital departments to 10 to 12 weeks in district hospitals with limited physiotherapy coverage. For acute and subacute musculoskeletal injuries, where the biological window for optimal rehabilitation is measured in weeks, a 12-week wait means you are beginning physiotherapy when the condition has already transitioned to a chronic state. Scar tissue has formed in the configuration of the injury. Compensatory movement patterns have been rehearsed thousands of times. Secondary deconditioning has accumulated over months. These are the conditions that make rehabilitation take longer and outcomes harder to optimize. Private physiotherapy clinics in Malaysia typically offer appointments within 2 to 5 working days for standard cases, and same-week availability is common for urgent presentations. The second dimension is session quality and continuity. Public hospital physiotherapy sessions are typically 30 to 45 minutes in duration. In high-volume departments, physiotherapists may see 10 or more patients per session, which limits the depth of individual assessment, exercise instruction, and manual therapy time available per patient. Patients in public settings also commonly see a different physiotherapist at each visit because staff rotation is standard in hospital departments. The result is a clinical relationship without continuity. Each physiotherapist must re-establish context, reassess progress, and rebuild the working knowledge of your specific movement patterns that drives effective rehabilitation. Private physiotherapy sessions typically run 45 to 60 minutes. Patients see the same physiotherapist consistently, which allows a progressive rehabilitation relationship that builds on each preceding session. This continuity allows the physiotherapist to recognize subtle day-to-day variation in your movement and pain that is clinically informative but invisible without a continuous relationship. The physiotherapist knows how you moved last week, what changed when the exercise was modified, and which approaches you respond to best. The third dimension is cost. Public hospital physiotherapy in Malaysia is heavily subsidized, typically 5 ringgit to 10 ringgit per visit for Malaysian citizens with a valid GP or specialist referral. Private physiotherapy fees range from 80 ringgit to 250 ringgit per session, depending on the physiotherapist's qualifications, the clinic's location, and the complexity of the service. For patients with SOCSO coverage from a workplace injury, EIS coverage for retrenchment-related conditions, or employer group medical insurance, private physiotherapy may be claimable with minimal or zero out-of-pocket costs. It is worth checking your coverage before assuming private physiotherapy is unaffordable. The fourth dimension is the quality of the clinical approach. Both public and private physiotherapists in Malaysia hold the same baseline qualification, a degree in physiotherapy from an accredited institution, and registration with the same regulatory body. Postgraduate specialization in sports physiotherapy, women's health, or neurological rehabilitation is more commonly available in the private sector, where continuing professional development is a competitive differentiator. Evidence-based exercise rehabilitation requires time to instruct properly, supervise, correct, and progress, and the session duration and patient load in a private setting supports this more consistently. The right choice between public and private depends on your clinical urgency, your coverage, and what your condition requires in terms of session frequency and continuity of care. For acute sports injuries and post-surgical rehabilitation where timing and continuity are critical, private physiotherapy with rapid access typically produces better outcomes. For stable chronic conditions where timing is less critical and the patient can wait, public physiotherapy represents good value and good care. The link in the description provides a comprehensive comparison of both systems and guidance on navigating insurance and SOCSO claims for private physiotherapy in Malaysia.